What if I told you that there are breakthrough treatments for erectile dysfunction that could restore your masculine vitality, yet most doctors will never mention them during your appointment? Today I am going to reveal the shocking new treatments that are quietly revolutionizing men's health, treatments that work when pills have failed you, when nothing else seems to help. I am Dr. Eva Hart, a certified urologist with 14 years of experience helping men over 60 reclaim their masculine strength. Throughout my career, I have witnessed countless men suffer in silence, believing that declining performance is simply an inevitable part of aging. But what I have discovered will challenge everything you think you know about erectile dysfunction. This is a topic that men rarely discuss openly, yet it affects millions of you. The silence around this issue does more harm than good. I want you to know that struggling with erectile dysfunction does not make you less of a man, it makes you human. And more importantly, it does not have to be your permanent reality. In this video, I will share with you 5 groundbreaking treatments that represent the cutting edge of male health restoration. These are not the same old solutions your doctor typically prescribes. These are revolutionary approaches that address the root causes of erectile dysfunction at the cellular level. This is about more than just performance. This is about reclaiming your confidence, your identity as a man, and your ability to connect intimately with your partner. This is about taking control of your health when traditional medicine has let you down. Stay with me until the end, because the final treatment I will share has shown remarkable results even in men who thought they had tried everything. And if this topic resonates with you, share in the comments what exactly speaks to you. And if it does not, let me know how I can improve the content and what topic would be more interesting for you. But first, I need to tell you something that will completely change how you think about erectile dysfunction. Most men believe this condition is purely physical, but recent research has uncovered a hidden connection that could be the key to your recovery. Keep watching, because understanding this connection could be the breakthrough you have been searching for. Let me tell you about something that is quietly happening to most men over 60. Your body is fighting a battle you probably do not even realize is taking place. Erectile dysfunction is not just about blood flow or hormones. It is about cellular deterioration happening at the most fundamental level of your masculine health. When blood vessels in your penis become damaged by years of poor circulation, inflammation, and cellular stress, traditional treatments only address the symptoms. They force blood into damaged tissue without healing the underlying damage. It is like trying to fill a bucket with holes in the bottom. You might get temporary results, but you are not fixing the real problem. I have seen men in their 60s and 70s who believed they were broken beyond repair. They had tried every pill, every injection, every device on the market. They came to my office defeated, convinced that their days of intimate connection were over. But what they did not know is that their cells were simply starving for the right kind of regenerative therapy. Truth is, your erectile tissue can be restored. The blood vessels can be repaired. The nerve pathways can be regenerated. But you need treatments that work at the cellular level, not just surface solutions that mask the problem. What I am about to share with you represents a complete paradigm shift in how we approach male sexual health. What makes this even more critical to understand is that the damage accumulates over decades. Every year of high blood pressure, every cigarette smoked, every month of poor sleep quality adds to the cellular deterioration in your erectile tissue. This is why traditional treatments become less effective over time. They are trying to force function from increasingly damaged tissue. The breakthrough treatments I am sharing work differently because they actually repair this accumulated damage at the source. Think of it as the difference between painting over rust versus actually removing the rust and restoring the original metal. This understanding is crucial because it explains why these regenerative approaches can work even when everything else has failed. Here is what most doctors will not tell you. Your own blood contains powerful healing factors that can regenerate erectile tissue. Platelet-rich plasma therapy, or PRP, takes a small sample of your blood and concentrates the healing platelets into a powerful regenerative serum. I have noticed something remarkable in my years of practice. When we inject this concentrated healing serum directly into erectile tissue, something extraordinary happens. The damaged blood vessels begin to repair themselves. New blood pathways form. sensation returns, and men start experiencing natural, sustained erections without pills or devices. One gentleman came to me after 5 years of failed treatments. Traditional medications had stopped working completely. Within 3 months of PRP therapy, he experienced natural morning erections for the first time in years. His wife told me later that she had her husband back, not just physically but emotionally and mentally as well. The science behind this is remarkable yet simple. Your platelets contain growth factors that signal your body to repair and regenerate tissue. When we concentrate these healing factors and deliver them directly where they are needed most, we are essentially giving your body the tools to heal itself naturally. But here is the part that will surprise you even more. PRP therapy does not just improve erectile function, it often enhances sensation, increases penis size slightly due to improved blood flow, and restores the kind of firm, lasting erections you may not have experienced in decades. What sets PRP therapy apart from other treatments is its natural approach to healing. Unlike synthetic medications that can have side effects and lose effectiveness over time, PRP uses your body's own healing mechanisms. The concentrated growth factors include platelet-derived growth factor, vascular endothelial growth factor, and transforming growth factor, all naturally occurring substances that promote tissue repair and new blood vessel formation. The procedure itself is relatively simple and can be performed in a medical office setting. Most men experience minimal discomfort during the injection process, and there is virtually no recovery time required. Many patients report initial improvements within 4 to 6 weeks, with continued enhancement over the following months as the regenerative process continues. Most men have never heard of this treatment, yet it represents one of the most significant breakthroughs in male health restoration in the past decade. Low-intensity shockwave therapy uses targeted acoustic waves to literally rebuild your erectile tissue from the inside out. Countless men tell me the same thing. They feel like their penis has become numb, unresponsive, almost disconnected from their body. What they do not realize is that the tiny blood vessels and nerve pathways have become damaged and need to be regenerated. Shockwave therapy does exactly that. Treatment involves applying focused acoustic waves to erectile tissue. These sound waves trigger a process called neovascularization, the formation of new blood vessels. They also stimulate nerve regeneration and break down the microplaques that block proper blood flow. The result is tissue that functions like it did when you were decades younger. This is not painful or invasive. Most men describe the sensation as mild vibration, but the results can be life-changing. One patient told me that after 6 weeks of treatment, he experienced erections that were firmer and lasted longer than they had in 20 years. He said it felt like his body had remembered how to be young again. The beauty of shockwave therapy is that it provides lasting results. Unlike pills that you have to take every time you want to be intimate, this treatment actually repairs the underlying damage. Many men maintain improved function for 2 to 3 years after completing their treatment protocol. What makes this even more exciting is that shockwave therapy works for men who have not responded to other treatments. Pills have stopped working for you. If injections are not effective, this could be the breakthrough you have been searching for. The mechanism behind shockwave therapy involves the release of growth factors and the activation of stem cells that are naturally present in your erectile tissue. The acoustic waves create controlled microtrauma that triggers your body's healing response, similar to how exercise creates beneficial stress that makes muscles stronger. Each treatment session typically lasts about 20 minutes, and most protocols involve 6 to 12 sessions over several weeks. Treatment is so gentle that you can resume normal activities immediately afterward. Research studies have shown that up to 80% of men experience significant improvement in erectile function, with many achieving natural erections without the need for medications. Treatment also improves penile sensitivity and can enhance overall sexual satisfaction for both partners. Here is what most doctors will not tell you about the future of male health. We can now use your body's own regenerative cells to rebuild erectile tissue at the cellular level. Stem cell therapy represents the most advanced approach to treating erectile dysfunction, and the results are nothing short of remarkable. I have observed something troubling in my years of practice. Men are told that erectile dysfunction is just part of aging, that they should accept declining function as inevitable. But what if I told you that we can actually reverse the aging process in your erectile tissue? Stem cell therapy involves extracting your body's own regenerative cells, usually from fat tissue or bone marrow, concentrating them, and then injecting them directly into erectile tissue. These cells have the remarkable ability to transform into whatever type of cell is needed: blood vessel cells, nerve cells, smooth muscle cells. One of my patients, a man in his early 70s, had not been able to achieve an erection in over 3 years. Traditional treatments had failed completely. 6 months after stem cell therapy, he experienced spontaneous erections and was able to maintain intimate relations with his wife for the first time in years. He described it as getting his life back. The science behind this is fascinating. As we age, the stem cells in our erectile tissue become depleted and less active. By introducing fresh, concentrated regenerative cells, we are essentially giving your body the building blocks it needs to repair decades of damage. What sets stem cell therapy apart is its ability to address multiple aspects of erectile dysfunction simultaneously. It improves blood flow, regenerates nerve pathways, and restores the smooth muscle function necessary for firm erections. This comprehensive approach often produces results that far exceed what traditional treatments can achieve. The most promising aspect of stem cell therapy is its potential for complete tissue regeneration. Unlike other treatments that work around damaged tissue, stem cells actually replace damaged cells with healthy, functional ones. The process begins with a simple outpatient procedure to harvest your stem cells, followed by laboratory processing to concentrate and activate them for maximum therapeutic benefit. These activated stem cells are then precisely injected into specific areas of erectile tissue using advanced imaging guidance. The regeneration process continues for months after the treatment, with many men reporting progressive improvement in both function and sensation. Recent advances in stem cell processing have significantly improved success rates, and when combined with growth factor therapy, the results can be truly transformative for men who had given up hope of natural recovery. If you are reading this and it resonates with you, type plus in the comments. It is important for me to know that this information is helping you. But there is something even more revolutionary that I need to share with you. While these treatments are remarkable, there is one approach that combines multiple breakthrough technologies into a single comprehensive protocol. Keep watching because what I am about to reveal could change everything. Most men do not realize they are being shortchanged by single treatment approaches. The most dramatic results I have seen come from combining multiple breakthrough treatments into a comprehensive regenerative protocol. This is where the real magic happens. Let me share something that quietly destroys treatment success: doctors who offer only one solution. Whether it is just pills, just injections, or just one type of therapy, single approaches often fall short because erectile dysfunction is a complex, multi-system problem that requires a multifaceted solution. The most successful protocol I have witnessed combines PRP therapy with shockwave treatment and targeted nutritional support. PRP provides the growth factors and healing proteins. The shockwave therapy stimulates new blood vessel formation and nerve regeneration. The nutritional support ensures your body has all the building blocks needed for tissue repair. I treated a gentleman who had struggled with severe erectile dysfunction for 8 years. He had tried every individual treatment available with minimal success. Within 4 months of starting our comprehensive protocol, he achieved erections that were stronger and more sustainable than he had experienced in over a decade. The reason combination protocols work so well is that they address every aspect of erectile function simultaneously. While one treatment is rebuilding blood vessels, another is regenerating nerve pathways. While growth factors are healing tissue, acoustic waves are breaking down blockages. Your body gets multiple healing signals at the same time, accelerating the recovery process dramatically. What makes this approach even more powerful is that the treatments enhance each other. PRP therapy makes tissue more responsive to shockwave treatment. Shockwave therapy increases the absorption and effectiveness of growth factors. The synergistic effect often produces results that are far greater than the sum of individual treatments. This comprehensive approach also tends to produce longer-lasting results. Instead of temporary improvements, men often experience sustained enhancement that continues to improve months after completing the protocol. Timing and sequencing of combination treatments is crucial for optimal results. We typically begin with shockwave therapy to prepare the tissue and stimulate the natural healing response. This is followed by PRP injections when the tissue is most receptive to growth factors. Nutritional optimization runs parallel to both treatments, ensuring your body has the raw materials needed for tissue regeneration. Some protocols also incorporate hyperbaric oxygen therapy to enhance cellular healing and reduce inflammation. The entire process is carefully monitored and adjusted based on your individual response. Advanced imaging techniques allow us to track tissue changes and blood flow improvements throughout the treatment process. Many men are amazed to see objective evidence of tissue regeneration and improved vascular function, which provides both reassurance and motivation to complete the full protocol. Revolutionary Treatment 5: Personalized Genetic and Hormonal Optimization. Here is something that will transform how you think about erectile dysfunction. Your genetic makeup and hormonal profile determine exactly which treatments will work best for your body. This is the future of personalized male health, and it is available right now. I have noticed a disturbing pattern among my patients: men receiving generic treatments based on outdated protocols instead of personalized medicine tailored to their unique biology. This one-size-fits-all approach is why so many men do not get the results they deserve. Advanced testing can now identify your specific genetic variants that affect nitric oxide production, blood vessel function, and hormone metabolism. We can measure not just your testosterone levels, but how efficiently your body uses testosterone. We can identify nutrient deficiencies that are sabotaging your sexual health. One patient had normal testosterone levels but genetic variants that prevented his body from using testosterone effectively. Traditional hormone therapy had failed him completely. Once we identified his genetic profile and customized his treatment accordingly, he experienced dramatic improvements in erectile function, energy, and overall vitality. This personalized approach also includes optimizing factors that most doctors never consider: your sleep quality, stress hormone levels, inflammatory markers, and metabolic health. Everything in your body is connected, and sexual health is a reflection of your overall health optimization. Testing process is simple and comprehensive. We analyze your genetic profile, hormone levels, nutrient status, and inflammatory markers. Then we create a personalized protocol that addresses your specific biological needs. The results are often remarkable because we are working with your body, not against it. What makes this approach revolutionary is that it eliminates the guesswork. Instead of trying different treatments and hoping something works, we know exactly what your body needs to restore optimal function. This precision medicine approach often produces faster, more dramatic, and longer-lasting results. Men who undergo personalized optimization often report improvements that go far beyond erectile function. They experience increased energy, better sleep, improved mood, and enhanced overall vitality. They tell me they feel like themselves again, strong, confident, and fully alive. The genetic testing reveals information about how your body processes medications and responds to treatments. We analyze genes related to inflammation and cardiovascular health. The hormonal assessment includes testosterone, estrogen, and thyroid function analysis to identify imbalances and create targeted treatment plans. These breakthrough treatments represent hope for every man who has been told that declining sexual function is just part of aging. Your masculinity can be restored naturally. Your confidence can return. Your intimate relationships can flourish again. Key is understanding that erectile dysfunction is not a character flaw or an inevitable consequence of getting older. It is a medical condition with real solutions, and the most effective treatments are often the ones your doctor has never mentioned. Whether you choose PRP therapy, shockwave treatment, stem cell regeneration, combination protocols, or personalized optimization, remember that taking action is the first step toward reclaiming your masculine vitality. You have more control over your sexual health than you have been led to believe. This information has opened your eyes to new possibilities. Share what resonated with you most in the comments below. Your journey back to confident masculinity can begin today, and these revolutionary treatments are waiting to help you reclaim the vitality you thought was gone forever.